Welcome, everyone. My name is Jordan Teicher. I'm the Director of Content and Communications here at Cedar. And joining me is Midori Uehara, our VP of Business Development. Midori, how's it going?
Going great. How are you, Jordan?
I'm good, thanks. I know that Midori and I are very appreciative that you're joining us today. We have a great presentation planned. It's based on some original research that Cedar conducted in the past couple months. Before we get into that, I want to go over some quick housekeeping. We use a platform called Hopin for virtual events. There's a stage component now. This is where you are. There's also a reception area where you can go for some resources. Midori and I will be presenting for about 20 to 25 minutes. And then we have 10 minutes or so set aside at the end for Q&A. So I highly encourage you to drop in questions as you have them along the way. You don't have to wait till the end. But you can do that right in the chat function on the right side of your screen. And if you have any technical difficulties along the way, we also have someone on standby who should be able to help with anything that comes up. So with that, let's get into it. So before we dive into the data, I wanted to start with a little word association, kind of an icebreaker just to get the juices flowing. So using the chat here, I'll say a couple terms, and I want everyone who's here today to just drop in the first thing that comes to mind. There isn't a right or wrong answer. Just take 5 seconds and put it into the chat. So what is the word that comes to mind when you hear healthcare? Let's see what people have to say. Midori, how about you? What's the first thing that comes to mind when you hear healthcare?
When I hear healthcare, and this probably belies the fact that I've worked in the industry for a while, is complicated. That's my knee-jerk reaction. Really curious to see what others think. Don't overthink it. Looks like Sandeep and I have the same instinct around complicated and complex.
Yeah, I think that's a good one. Very topical for today. Doctor stress cost. Okay. Frustrating for sure. I feel
That's for sure. Yep. Inefficient.
Expensive.
This wonderful industry that we work in. Lots of work to do.
Okay, let's do one more. It might relate to some of the answers here. What is the first thing that comes to mind when you hear the term medical bill? Midori, what do you think?
Yeah, with medical bill, I think stressful. That's what we hear from a lot of patients. And I've experienced myself as a patient too, receiving bills that are complicated, that are large, that don't seem to make sense. But yeah, excited to hear. We've got some other, incomprehensible, expensive, look away. A lot of overlap as well with what folks who are attending are experiencing too.
Yeah, for me, I don't know if emojis are eligible, but I think of just a bright red X. That's my visceral reaction. I think that's in line with some of the other things we're seeing in the chat. Okay, appreciate everyone dropping some words in here. I think we're going to touch on a lot of the topics and concepts that you brought up here. All right, so let's get into some of the research quickly on our methodology. So we conducted this study in the fall with The Economist. It's actually the third annual report we did in our series, but the first one that we did with The Economist, we had over 1,500 people participate. Everyone was at least 26 years of age, and everyone had either paid for a medical bill for themselves or for a dependent. And we wanted to look at some of their pain points. What do they think about the overall experience as they were going through care and also the payment process there? So what you'll learn, 3 big trends kind of emerged when we started looking through all the data and crunching the numbers. So to set expectations, we're going to cover why most consumers find healthcare bills stressful and confusing. We're going to look at how providers and payers can increase retention and loyalty. And then we're going to look at some more tactical changes that might incentivize people to pay their bills on time and in full. So with that, let's get to the first section, which is on medical bills and why they're a huge source of anxiety, mystery, and frustration for consumers. So we wanted to make this kind of our establishing point. Healthcare billing is flawed. Not the most newsworthy thing that you're going to hear today on our presentation, but important nonetheless. You can see here, a majority of respondents told us that they find it stressful paying a healthcare bill, and 59% find it stressful reconciling that bill with a payer. But I think beyond this point, once you start saying healthcare is broken, healthcare is flawed, healthcare is messy, sure, we'd all probably agree with that to some degree, but it's a very daunting problem. It's hard to wrap your head around, okay, sure, what do we do next? So that's where we wanted our research to shine, was to look at some of those areas and opportunities for improving some of these flaws. And quickly, it became clear that the first thing customers really want is to know and understand the final cost. And I think knowing and understanding, it's important to group them together, because just having that final price is part of the issue, but it's really understanding and being clear on why the charge is what it is. So we started digging deeper. We wanted to look at reasons why a medical bill went to collections. Of course, part of it is affordability. 48% told us they were unable to pay their requested amount. And some of that might be out of our control as payers and providers and people working with consumers in the healthcare system. But I think there are a few areas where we can start to make an impact and start looking at ways to improve this experience beyond the cost itself. And a lot of this comes down to process. 32% believe they were billed the incorrect amount. 28% found the bill too confusing or couldn't decipher the cost. And 24% said that the provider had poor and outdated billing protocols. People, for the record, people could have selected multiple things here. So even though affordability was the number one choice, there's still other parts, other elements in the equation that had an effect on why something went to collections. And another part of our survey was to talk to some experts. We talked to people on the payer side, on the provider side, and some third-party, more neutral experts to see what they think. What are the big issues they're seeing, and what are some solutions to those issues? And I love this quote from Doug Watson at Unity Point. He broke down a few different groups of consumers that you see. Some people who just look at the bill the first time they get it and just check out. It's too complicated. They don't get it. It's a headache they don't want to deal with. You have this other group of people who actually intend to pay, but never actually get around to it. And I think we can focus in a bit on those, because his point was that if you make it easy with the click of a button for people to pay, they're happy to, as long as they had a good experience with their care. And that actually ties back to some data science research we know internally at Cedar, a bit separate from the report, but we found that there's a growing demand for people to resolve small bills, in this case under $100, by doing it in under 3 clicks, maybe using Apple Pay or another digital payment option. So just something to think about there. And then put that in the context of our day-to-day lives. So we have a smart house here. Let's say someone wakes up, the first thing they might do is ask Alexa to know what the weather is. Then they can go to Siri and find out if there's any traffic before they have to drive somewhere. When they're working, it's very easy to find all the Slacks or the messages from their coworkers. Maybe later at night when they're done working, they turn on Netflix and there's an algorithm that tells them exactly what they can watch that they'll enjoy based on their preferences. And throughout the day, if you actually count it up, we have probably a dozen or more of these different touch points that are really easy. They reduce a lot of friction and they make our decision-making a lot easier. But then you have the healthcare experience, which of course is in stark contrast to a lot of this. So the expectations of the consumer, just based on everything going on outside of healthcare, still have a huge impact on this experience when we're dealing with doctors and hospitals and trying to make sense of these bills. So how do you address these challenges? I think the first is setting those clear expectations up front around the billing and administrative processes. Of course, you want to reduce friction, as I just mentioned. And then third, which I think we're going to touch on a bit later, is empower consumers to find solutions on their own through technology when it's appropriate. All the technology in our lives make it easy to find information. So I don't think healthcare should be any different. And with that, I'm going to hand it over to Midori for some more insight there.
Yeah. Thank you, Jordan. And there's so much good insight in the data that you just shared, and some commentary before speaking to this slide. But I think that, and this is my orientation too, that was revealed when I said the first thing I thought of when I thought of healthcare was that it's complicated, was that consumers' preferences actually aren't complicated. They're pretty clear. They reveal themselves to us through every other consumer interaction. So, and through advanced data science and user research and just tracking and modeling consumer behavior, we know what works for them from a user experience perspective. And some of those problems are very solvable today. Some problems in healthcare are more complicated. And so I want to spend a moment talking about that, where, this intuitive solution, just tell me the final cost, very simple. Why is that so hard to execute? And I think a lot of folks on this call probably know that deeply because it's your work every day. But I want to speak to some changes that are coming about in the industry that will create some new incentives and potentially new models of working together to help us get to that intuitive solution. So if you move on to the next slide, Jordan. No surprise to this group, the No Surprises Act was passed in 2020, and many major parts of the act have gone into effect at the beginning of this year. So just to set a foundation, because there probably are folks here who haven't come across this yet, but the No Surprises Act has a few different components. At a high level, it prohibits surprise billing when patients are seeking emergency services or other services at an in-network facility, but they're receiving care from out-of-network providers who may be practicing within that facility. And so that's a major pillar of the law intended to shield patients from surprise out-of-network billing when they did the diligence, looked up an in-network facility, went there, but then, unbeknownst to them, they ended up receiving care from out-of-network providers. And so this is addressing this stat that we found through our research that, close to 50% of US adults are worried about this unexpected medical bill. And that actually keeps them from receiving care. So this pillar of the No Surprises Act is going to have a big impact on consumer well-being and confidence that they won't get hit with a massive out-of-network bill, which could almost, there's really no upper limit to what out-of-network charges could be. So that is great news around the No Surprises Act. And so there are a couple other important components, though, that I'd like to call out about No Surprises that are relevant to other types of billing and that affect not just emergency services and the out-of-network pieces, and also affect estimates and understanding the final cost. So if you move on to the next slide, thank you. So this first one on the left-hand side is that pillar of the No Surprises Act that I just went over, where it provides a methodology and the act prescribes an approach for how those out-of-network services will be priced and insulates the consumer from being on the hook for kind of an open-ended bill. The right-hand side is another part of the No Surprises Act that went into effect this year, and it requires providers to provide a good faith estimate to uninsured or true self-pay patients for the whole bundle of services that they may be receiving. And so what that means, an example for that is, let's say a patient is getting a surgery, could be, at an ambulatory surgical center or inpatient. And we know that the facility component is a big piece of what the patient is going to pay, but the other providers, the physician, the surgeon doing the surgery, the anesthesiologist who's doing the anesthesia beforehand, may all be separate and not employed by the facility and maybe billing separately. And so what this part of the act requires is that the facility provide an estimate for all of those services across the board. And this is a challenging thing to comply with right now, because we don't have systems that talk to each other across the different providers when they're looking to provide an estimate. There's no way to coordinate across all those estimates, not to mention estimates generally suffer from poor data quality and a lot of noise, given the confusion around what codes are actually going to be billed for. And then you hit that up against, deductible status for a patient if they are insured. You don't come across that as much in the true self-pay, but this requirement that's coming top down introduces a host of new challenges to address, but I think is a major opportunity for providers and technology partners to step up and actually deliver what consumers are telling us very clearly they want and what they're asking for. And it matches, better matches the consumer's billing experience to their clinical experience. So, eager to hear in the chat or maybe as a follow-up how folks on the call are thinking about this. I know we're thinking a lot about it at Cedar. So it's a big change in our industry and one that we're positive, we think will have some positive effects for the consumer experience. Oh, Jordan, I think you're on mute.
I am on mute. I just wanted to say I love the way that you phrased it. Sure, some of these problems are really complex, but what consumers want is actually pretty straightforward. And section 2 will get into some of that in more detail. So here we're looking at referrals, repeat business, loyalty, and the research revealed that aside from the care aspect, the follow-up interactions after care had a huge impact on how consumers felt here. And I'm thinking about this in terms of healthcare's recency bias problems. So a quick psychology, recency bias, the last interaction you have has an outsized effect on your overall perception of what went on. So for healthcare, this is super important. Let's say you need to go see a doctor. You call them up. It's pretty easy to get an appointment. You have a great time finding parking there. It's really easy. The people at the front desk are nice. The doctor takes you in on time, solves your problem. But then a month later, you get a bill and it's really confusing. It doesn't make sense. You're not sure why some charges are there. And then that really colors your whole experience, even though the rest of it was pretty good. And those things that came before it are still very important. But in terms of the end-to-end journey, finding a way to improve that billing experience can have a big impact. We found that 26% of respondents left a negative review for a provider based on a bad billing experience, even if care otherwise was pretty good. So delivering this great financial experience is more important than ever because, as you can see here, 96% of consumers told us the quality of that experience was really important in terms of payer satisfaction, and 93% said it really impacted their decision to return to a provider. Now, it's really hard to find 93 or 96% of people to agree on anything, but the fact that we did it here, I think, is super telling. And it gets at some areas of personalization and customization that can help deal with the referrals and building that loyalty. So I'm calling it here the consumer wish list. About 2/3 of respondents told us they want to customize the experience, especially around payment and communication preferences. More than half want a digital payment option or to pay through a patient portal. And then the last 3 here, a bit lower, but still very important, all about being able to do things easier, right? Prior authorization, doing that online, reconciling payment issues online, paying premiums online. All of these things that I think are manageable and doable as long as they're personalized to the individual. And then looking at it a bit on the flip side, so what are the main drivers of dissatisfaction? What's preventing loyalty here? We asked people to rank the top factors, and a lot of it came down to clarity, right? 37% said clarity of communications from the provider wasn't great. About the same looked at the intelligibility of their EOBs. And the last one here I really want to focus on. So 34% pointed to alignment between the healthcare bill and the EOB. And I think that coordination between payers and providers, which we'll touch on a bit more later in the presentation, but it's going to be a huge theme going forward, because a great way to reduce that burden on the consumer is to make sure that the payers and providers are negotiating it and working behind the scenes before the consumer gets involved. So with that, I'll hand it over to Meadery for some more context.
Great. Thank you. And I'm happy to highlight another terrific quote we have from the expert interviews that we conducted as part of this research from Jeff Logan at Providence. And he says, the whole goal is to provide a much more personalized, engaging, convenient patient experience. Personalized, engaging, convenient. we're taking inspiration from organizations that have learned how to communicate effectively with consumers in a way that resonates with them and demystifies the process. And so here again, we hear underscored by leaders in the industry, you need to provide clarity and you need to do it in a consumer-friendly way. And I think if you go to the next slide, there's a role for both providers and payers to play in delivering on those consumer needs. So I think on the provider side, and just thinking about how our industry is structured, providers are responsible for billing patients and sending those communications out. And so I think focusing on convenience, how you make that frictionless, how you make that really easy is a good place for providers to spend time. And then a second place is just providing that first order clarity. So is your bill written and, are you translating codes into understandable and clear language that, a lay person could understand? Have you mapped out kind of just the basics of, you were here on this visit, you saw these things happened, this is why you owe what you owe. So I think there's a lot to be done on delivering on clarity and convenience on the provider side. Payers, of course, are a huge part of the puzzle because payers are responsible for applying benefits. And they also track and manage accumulators. And both of those things tie in directly to patient out of pocket and what that final cost is. And so on the payer side, improving benefit application and clarity and also communicating that to patients is crucial. And then clarifying that patient out-of-pocket responsibility in a consumer-friendly way. Let's say a balance is split across a deductible as well as a coinsurance. Can you make that crystal clear for a patient so that they know, okay, I see this is why I owe this part in full, but this piece I'm only paying 20% or whatever it may be. And then I think the big opportunity is in the two coming together and not just kind of lobbing over the fence what they own, but instead actually collaborating and coordinating so that on behalf of our consumers, the shared patients, they're actually presenting a full picture that resonates with the consumer, that is personalized, engaging, convenient, and crystal clear. So I'll more to say, of course, on the details of what that looks like, but I think I will hand it back to you, Jordan, to keep going to this third section.
All right. And I'm double checking. I'm not on mute this time, so I think I'm good.
You're good.
The third section is really the bottom line. It's about how billing transparency is going to benefit consumers, providers, and payers. It's going to have positive outcomes for everyone involved. All this digital experience that we're talking about really needs to get toward that bottom line number. And there's a great quote here that I put at the top of the slide from one of the experts in the study. Everyone thinks the patient is trying to get out of paying, but they actually want to pay. I think this also goes back to Doug's point on the slide that I highlighted a bit earlier, finding ways to make it easy. People actually want to pay for good care. If they have a good experience, that deserves to be compensated fairly. So what gets to that point? 79% of people told us they're actually willing to pay upfront for these out-of-pocket costs, even before the visit or at the visit. And I think the way that they'll do that and be okay doing that is if everything is a bit more clear, like Metery pointed to, not just kind of lobbing it back and forth, but really making it easy for them to see everything on one page. 65% want to view real-time benefits in the same place as their bill, right? Back to that same point. And then 63% would generate out-of-pocket costs for specific services if offered by their provider. So also visibility is important here, right? You can be super clear, you can make things easy to understand, but if people don't know where to find it, that's still an issue as well. So price transparency is a work in progress. I think the No Surprises Act is going to impact this a bit. We have about 60% of respondents in this study told us they've tried to look for out-of-pocket costs ahead of receiving care, but a pretty good portion of them, 40%, couldn't find it, or if they did, they said that it was inaccurate. So in the research, we found what people really want is cost certainty. And of course, these two things have to do with each other, but if we can get to that one final price that is reliable and credible it leads to better outcomes for everyone, because ideally the consumers will be paying on time and in full because they're more confident about what's expected and what's coming up after their care. So
Yeah.
Miri, can you walk us through some of the demographic research and wrap it all up for Q&A?
Yeah. I think this is maybe surprising to some folks, because I think, younger generations there's a stereotype that they want a more transactional healthcare experience. And so, the question here is, what is the willingness to pay a guaranteed out-of-pocket price upfront? And we see that the percentages and willingness is very high across the board, across demographics. Whether, you're a millennial or Gen X or boomer, we're all looking at 70+%, approaching 90%. So I think that what this tells us is that it doesn't break down by age or by demographic group. It really is a consistent consumer trend, and is only going to increase as we get even newer generations that will probably have even increased willingness age into the healthcare system. So I think if you go to the next slide, Jordan, I'm getting back to this kind of broader point that this research shows, which, we have some insight into what consumers want. There are some things that we can do, low-hanging fruit, without major regulatory change. But at the same time, there's still some pretty tough nuts to crack when it comes to delivering cost certainty, because of the way that healthcare pricing is structured in this country for the most part, where we have fee-for-service pricing, so that the payer-provider contracts, the price for a given episode of care can vary significantly, almost infinitely, depending on what actually happens in the visit. And then the popular plan designs of having deductibles and coinsurance, where what the patient owes is a function of the price that is identified between the payer and the provider. And so, those are kind of the facts of how most of healthcare is priced today. So what do we do if we're trying to provide cost certainty in that environment, short of changing all of the payer provider contracts, which might happen over time. But, I'll throw out a couple of ideas. They're not mutually exclusive. I think we actually see a lot of these happening all at the same time right now. And I'd also invite folks on the line to put into the chat what they think this will look like, or what their organizations are pursuing. So some ways that we can get closer to that cost certainty. First, we could just get better at predicting and then serving at the right time the estimates for prices ahead of time. And there's certainly room for improvement here. So we have not maxed out on estimate accuracy or timeliness of delivery. So there's a lot of work that we can do in this first bucket. A second way that we can deliver cost certainty upfront to patients is to shift to flat benefit models. So for example, copay for a given service, have the benefit be a out-of-pocket, a copay, and not a deductible or coinsurance, because that way it's known upfront, regardless of what happens downstream or happens in the actual visit, the copay remains the same. And so that provides cost certainty for patients simply through a benefit design change. And then the third is, and we're certainly seeing this, many next gen providers are bypassing insurance and going direct to consumer because of the challenges of managing insurance and the lack of consumer friendliness. So I think this is a trend we'll also continue to see, and that some practices will probably then bleed over into the insurance market. So some ways that transparency will continue to improve, and we'll get closer to cost certainty in the coming years. And so if you go to the next slide, and this is where I'll wrap up. I think that we talked a little bit about the No Surprises Act and earlier on this webinar. I think there's a continued role for smart regulation to play in the industry, in creating an even playing field and creating incentives for the industry to coordinate and collaborate. And so on this first-hand side, good faith estimates by providing this top-down mandate to provide a holistic, comprehensive good faith estimate for uninsured. Some of those connection points could potentially then be used for the insured population so that we can offer the same type of holistic good faith estimate for everyone, regardless of insurance status. And then around interoperability, one thing comes or stems from the other. If you have to do something, then you've got to figure out how to make the systems talk to each other so you can do it at scale. And so I think regulation can also be a very helpful prompt in creating a compliance need, and then, hopefully then later incentivizing a business model need for interoperability. And then the third thing that regulation can support is, just simplifying collections for patients and providers. So I think that right now there's a lot of manual effort still required to communicate and then collect from patients on their out-of-pocket responsibilities. If we're doing the other things right, providing better estimates, approaching greater cost certainty, implementing interoperability, the financial performance at the end of the day will also improve. So with that, I will open it up. I think we've got a couple of questions that came through. We also had a poll, so I think we're waiting for those final results to trickle in. But maybe we can start, Jordan, with the question from Zach.
Sure. Yeah. And thanks to everyone who filled out the poll. Keep filling it out if you haven't yet. Right now, the most popular vote is all the above, for the record. But Zach, thanks for the question. So has Cedar done any research into how consumers respond to being educated about the No Surprises Act? We're working on it right now. I think some of the existing research from the report touches on it, about how often people are trying to find out information about prices, whether or not they're public. And I expect that to be more prevalent in the future. I think we've heard anecdotally from a few providers that people aren't asking about it yet, but maybe in the coming months or over the rest of 2022, they will, once there's more visibility and a little more knowledge around what's involved and what they can do. All right, Midori, here's a question for you. What does a proper marriage of bills and claims/EOBs look like?
Yeah. There is so much opportunity for us to improve the connection points between bills and EOBs or claims. I think optimally, they are the same communication. There really isn't a need for there to be a separate statement. What's required is that you can understand your insurance coverage, and that is, required from a legal and regulatory perspective. So I think a proper marriage is that they're the same communication, and that all of the information that you get from an EOB is embedded in the bill, and it's sanctioned and kind of stamped by your payer. So it requires the payer and provider to be working closely together on the back end. And if you have interoperable systems that talk to each other, and the right coordination, then this is absolutely achievable.
Okay, I think we have a couple more minutes for questions if anyone wants to fill them out. One that we got was about the idea of what are providers doing well. I mean, I think the survey did a good job of highlighting gaps and opportunities. But one thing that we do want to call out that I think is showing progress, people really responded well to the new COVID protocols, the safety precautions, the virtual care that were spun up last year, pretty much on the fly. And I think the consumer reading on this was, okay, if healthcare organizations can innovate there, then we want to see how they can innovate on the billing and administrative sides. So quick answer there. All right, so quick update on the poll question. There's a tie now between all of the above and the process answer of getting the right tech stack in place. So if no one has any other questions, we can wrap up there. We're almost at time anyway. Just want to say thanks to everyone who joined. We have another event coming up in February on healthcare equity and diversity. So stay tuned for more information on that. And as a follow-up to everyone who attended, oh, we do have a question. Okay. So Charlie asks, how do you address affordability Your research shows 48% can't afford care. How do you address that? Meadery, that's a big question. Do you have any answers?
Yeah, I'd say I would put that in one of the complicated categories, but there are things that can be done that are less complicated. So, for example, actually all health systems have financial assistance available, but it's not always very easy to access. And folks who are eligible may not be aware of it. It may not be easy for them to apply. Similarly, they may be eligible for Medicaid or other public insurance. They may not be able to easily apply to that either. And so I think the way that we think about, what are some of the ways that we can use technology and improved process to connect people to resources that are already there? I think there are some wins in there without changing the structure of the industry or so kind of absent regulatory change or other massive shifts. There's a lot that we can do in connecting folks to resources that are already available in a much more consumer-friendly way. But it's a multifaceted issue, one that is super important for us to tackle in a multifaceted way as an industry. And so we need to be doing a lot of different things at once. One thing, from a consumer perspective, or just connecting consumers to resources, I think that's something that we can put into place right away.
And I'll briefly add on top of that, I think the No Surprises Act can help here with affordability. If we stop having the surprise billing for any out-of-network charges, you might see that 48% answer dip a bit lower, which I think we can all do.
It's a great point.
Okay, so we will follow up with everyone within the next 24 hours. We'll give you a recording of the presentation, and you'll also get exclusive access to a brand new research brief that highlights a lot of the data we went over today and has some new information for you. So you'll be the first to see that. We haven't released it publicly. Otherwise, thanks for joining. Thanks for asking great questions, and hope you have a great rest of your week.
Thanks so much.